Hello, everyone. This is Kevin McManus with Great Systems. I'm very happy to be with you virtually today. I would like to have been at the Healthcare Systems Process Improvement Conference in Louisville this year. Was not able to make it, but I still wanted to share my content with you. So look at this like an introduction. You're going to get to know me a little bit more, and you're going to get to know a little bit more about what it's like to pursue process excellence in healthcare. And I'm going to tell you right up front, I have never worked in healthcare. Now, as a Baldrige examiner, I've actually spent more time in healthcare than I did as a patient. My grandmother was a nurse, my mom was a nurse, my niece is a nurse. I appreciate the heck out of what the folks in healthcare do, but I have not worked in the environment. However, through the National Baldrige Program, I've had the chance to go on site visits to around 7 different healthcare systems of a variety of sizes. And I think that's one of the cool things, both large and small. And so I've had a chance to go to the small ones. I've had a chance to go to the large ones. And in the examples we're going to look at in this presentation, and the examples I'm going to refer you to if you're interested in additional study, you get that mix. You get the mix of a healthcare system in downtown Los Angeles versus the healthcare system in rural Iowa. And so it's going to be very interesting to see actually the similarities more than the differences that exist across the different healthcare systems that these folks use to provide patient care. Now, this is a high-level view, 45, 50-minute view. And so take notes. Identify things you'd like to learn more about. I'm quite happy to help you more with it, but I'm going to share with you the highlights as they relate to the Baldrige Award. But I have found, after being an examiner for 20 years, applying this myself in 3 or 4 different organizations, depending on how you count it, I live it today. I think it's just a super model for building a great organization, but I think an organization that reflects what's truly important to you. Because to me, one of the unique things about process excellence is the organization should be defining who they are, where they want to go. That's their mission, vision, and values. And then how well do we live that? That's what we look at when we come in and look at healthcare systems from a Baldrige perspective. And so if you say you want to be the best healthcare system in the rural counties of Iowa, that's the type of benchmarks we might want to have you compare against. And that's one of the things that makes Baldrige unique now with healthcare is there's such a great benchmarking opportunity that exists post-Affordable Care Act. And so you can pick cohorts that are similar to you. You can decide, do I want to go for 25 percentile? Do I want to go for top 10 percentile? But what is excellence? What is your mission, vision, and values of your healthcare system? And so I do hope you can pick up some key metrics. I give you plenty of examples that you might be able to use, some improvement actions you might want to take, even if it's just learning more about what process excellence looks like and how you measure it. But I do want to give you a high-level view of 2 key things: how we assess strength versus in need of improvement, and then where you can go to get some examples of healthcare system best practices. Because if you don't reinvent the wheel here, you can make a lot of progress in a relatively short time. Now, there's an analogy I like to share. And we're in Louisville, so that's fairly close to NASCAR land. But it has to do with the notion of restrictor plates. And there's 2 tracks where NASCAR restricts the speed on the vehicles for safety reasons. And that's Talladega and Daytona. And we could push drivers to go faster on those courses, but they can't. There's only so much airflow into the engine because of the restrictor plate. Now, organizations have the same type of thing. And right now, based on all my research and study and feedback from my customers, where our biggest gaps are is our leader standard work systems are not in alignment with what we say we want to be as an organization. So, for example, we might say we want to pursue process improvement across all service lines, and yet we have certain leaders that don't talk about process improvement at all within their service lines. And so until the work system guides the expenditure of time and the expenditure of effort and the right kind of models, it's hard to go faster. So you need to change your work system to get different results. We need to change how jobs are designed from a leader standard work perspective. We need to change how people are developed, both on the clinical and non-clinical side, from a training perspective. And it's a very good example in healthcare where so many great strides have been made on the clinical side. And yet, look at the opportunity that still exists from a process improvement perspective on the non-clinical side, on those processes that support the value stream, that support the delivery of patient care. Now, I'm going to say right up front, post-pandemic, all organizations have some restrictor plate issues out there. And these are not things they put in place themselves. It's almost a result of social change. All kinds of things, different things have happened, and I won't go into those details from here, but right now we have many organizations that are sitting there and their turnover rates are too high. Now, that's traditional within healthcare anyway. It's a hallmark of best practice healthcare systems because they tend to have relatively much lower turnover rates, but in general, we have turnover gaps. And often that turnover has been on the leadership side. And so we have too few supervisors trying to manage too large of work teams. And both of those ratios affect your potential for process excellence because the higher turnover rates get, the more people a supervisor has to manage, the less time there is for process improvement if you have that much built into your job to begin with. And if you look at the job design of many leaders in the traditional leader standard work system, defined or undefined, most of their time is spent providing patient care or supporting the provision of patient care. You don't see that much time built into a frontline leader's job in particular for project teams, for personal growth, for personal training, for a wide variety of things. We're lucky if we can even approach work-life balance. So there's that time element within the healthcare world that has to be accommodated to help accelerate the pursuit of process excellence. But post-pandemic, almost all organizations have these challenges. It's a matter of degree. You will see if you go and look at the updated applications for the most recent recipients from Baldrige, a couple of them fared pretty well during the pandemic. Now let's get a little definition down in front of us because operational definitions are important. Operational definitions play a key role within Baldrige, and even if you don't accept my wording or my verbiage within your own leadership group, within your own organization or team, try to come up with the answers to these questions yourself. It's a great little warm-up exercise, and please recognize what I'm talking about here works with any kind of organization. Okay, any size. So first of all, I define process excellence as being minimal waste, consistent improvement, best in class at meeting or exceeding customer expectations, and all of that's demonstrated by evidence, by trends over time. How do we achieve it? Well, we don't do it with a program. We don't do it with 15% of the workforce participating in an activity. We define and build process excellence into every employee's job. You can see it in the competency matrix. You see it in the job description. You see it in their performance metrics that they use at the work area. You hear it in their conversations. So that's how we achieve it. It gets integrated into how we provide care. And then from a results perspective, how do we know if we are making progress or not? Well, there's three primary things we look at. First, we look for sustained improvement over time. Now, ideally, every year is better than the year before, but there may be cases where there's a down year or two. The key is if we look across 3 to 5 years, what do we see pattern-wise? You went from one level to a new level. And did you do it all at once, or was it a pretty steady growth rate? More importantly, have you achieved that type of performance in all areas you say are important? And so you may show that overall we've done great against our core benchmark metrics, but when we look at certain service lines, we see areas where we did not make our 25th percentile goal. but you determine what best in class is to you. Now, of course, you're not going to be considered a role model if you say, well, best in class for us is average, and if we're above average, we're doing good. And that could be true. But you won't get recognized through the award because we truly are trying to recognize role model practices. But that's something we work towards. We can't get there all at once. So I'm going to go through some quick self-assessment options just so you know what they are. We're going to do a very quick 1-minute self-assessment of our organizations, and then we'll move on from there. The whole point here is I like to keep this simple. I think at times the Baldrige process is too complex. The number of questions tends to overwhelm people if they don't understand the criteria. Sometimes even the nature of the questions overwhelms people because they may not speak in that type of language in their organization. But we're going to give it a go, and I'm quite happy to help explain things, help decode things, or translate things if need be. I'm more important on helping you define a path to excellence if you want to proceed that way. So the first simple thing we're going to do in a moment, we're going to pick a scoring band and think about some examples of why you chose to go one direction versus the other. Why didn't I go lower? Why didn't I go higher? Now on the NIST site, the NIST Baldrige site, you can download the Are We Making Progress as Leaders? Are We Making Progress as a Team? Assessments. They allow you to do multiple item assessments across the different process categories of Baldrige: leadership, planning, customer satisfaction, and so forth. Those are both quick assessments. They'll let you know where you're at. In one way, you can look at the core values and say, out of the 11 core values, how many do you feel we honestly support as an organization? That's a quick acid test. You can look at your results and say, how broad are our results? Do we look at results in all areas of performance? Do we look at process? Do we look at cost? Do we look at patient safety? Do we look at staff safety? Do we look at growth? Do we look at quality? How many different process areas have metrics? How well deployed is that? And all out, you could go with the 50-page application. And typically a 50-page application is about 25 to 30 pages describing how you do things, and another 25 or so pages showing how you did. In other words, what your results were. So a high percentage of results. So real quick self-assessment. What you see here is a portion of the scoring band descriptors. And what these are is once an examiner team has done a site visit, they've scored the applicant, we've got what we feel is our final score, we want to read these bands and take a very holistic, high-level view of the applicant and say, does this sound like them? And typically, process is ahead of results. Sometimes you'll see them like a 4 and a 4, but it's much more common to see process a band ahead of results. Now, what I've shaded on this picture is where the average organization typically falls. And you can see that's a pretty good range. That's a range between 430 and 540. And you don't have to meet all the examples provided in the box to fit in the box. You're beginning to enter the box. You're beginning to leave the box. I'm firmly in the center of the box. But this is a great way of getting into it. And yes, there are levels 2 and 1. Quite happy to send those to you, but I figured, hey, the main point you'll notice in a minute is when you look at these, you'll see it talks about basic criteria questions in row 3, and then it talks about overall criteria questions in row 4. And that's a fundamental difference when we look at the criteria. A basic question is typically one question for an item. 12 questions overall on the process side. Very high level. How do senior leaders lead? How do you develop strategic plans? Things of that nature. The value is in the overall questions and certain overall questions based on your goals as an organization. But what's on the screen is typical. Now, the very first thing you do, and this is interesting to me because we always tell organizations, first you have to do your profile. What I have learned is, even if you're a sole proprietor like me, you better do the things in the organizational profile to know who you are as an organization. To me, it's planning for the journey. It's Lewis and Clark getting ready to head off on the Missouri River to hopefully find the Pacific Ocean. Where are we going? Who's going with us? How are we going to get there? What do we need to take with us? Who are the suppliers and stakeholders we're going to interface along our trip that we need to work with? And I've boiled it down to about 15 or so visual items that you want to have to help define your organization. But it tells examiners and judges what's important to you. And like I said a little bit ago, we assess you against what you say is important. We don't say, well, they're not the best in the country, so they don't receive the award. No, they didn't aspire to be. They aspired to be one of the best rural healthcare systems in the Western United States. And when we look at their results, that's what we see. Okay? So we're going to dig into that a little different, but that is our starting place. And these are some of the key questions. And again, even if you're a sole proprietor in this day and age, you should be able to produce a paragraph or two for each of these questions. Now, about half of these questions are answered with a matrix or a table. And to me, those are blueprints. And what you're going to find is about half of the tables you see in an application are leader standard work blueprints if you put time into them. It's really cool how that falls out. But to me, you have to know who you are in this day and age as an organization. You need to know these things. So this is worthwhile just from a strategic planning perspective. Review and refresh kind of thing every year. Now, what I have found to be interesting is the growth in healthcare in Baldrige, because when I started in 1998, we did not even have healthcare criteria. And you'll notice our first healthcare recipient was in 2002. And we tended to have one or two a year in the first 8 years or 9 years of the award. There is a great amount of sharing that takes place within the healthcare world. I love that. As a patient, I love that. As a patient who is hopefully going to be around for a while, I very much love that. What's even better is when you have the opportunity to visit some of these places, and even some of these places that receive site visits but don't receive the award. They're just as good of health systems. But as we've progressed, I'm going to point out one more thing on here, because you can see the trend's fairly consistent, 2 or 3 a year once we got rolling. On here, you'll also see Donor Alliance, Mid-America Transplant, and I believe we have Center for Organ Recovery and Education. They're considered to be not-for-profits, but by the nature of their operations, and in particular the nature of how their supply chain works, their value stream works, I think it's worthwhile to include them. And because there's only so many of them in the United States, there's tremendous value in being a donor. And so I think the more we can spread this word, if you have any kind of connections within the Donor Alliance group for your geographic area, go ahead and pass this on, because Diane Brockmeyer at St. Louis and some of these other folks, they're happy to share the excellent stuff that they've done. But that's the case with any of these folks on here. And again, what I said earlier, the diversity of the healthcare systems is what is so cool. So you can go into these application summaries and build your own cohort group of Baldrige recipients, and just learn about those that are either similar to you or those that you aspire to be more like. And just a quick trend summary. I'm sorry it's not in graph form, but in general, what you'll see is healthcare got to the point to where it was more than half of the total applications each year, more than half of the site visits each year. A little bit different in 2021 naturally. but just very impressive to see how many healthcare recipients we've had, and even just how many healthcare applications and site visits we've had with everything that's going on. So a lot of folks to learn from. So in summary, why I believe in Baldrige, first of all, you have to prove your success. And it's not just a high level. It's a trend. It's a trend in all areas of importance. It's a trend against relevant benchmarks. We haven't talked about the scoring guidelines, but it's almost like a but wait, there's more. And when we talk about results, that's what we're getting at. What's the level? What's the trend? How does this look when we look at our different filters or splits or segments? And then how are we doing against those that we are trying to be as good at or better than? You tell us what's important. We don't tell you that your financial structure should be such, or that your service line should be such, or you should be investing more research or in resources in certain areas. You tell us what's important. The criteria are based on the core values. You can't get away from that. The program itself practices what it preaches. And if you had stock, there'd be a payback. It doesn't work 100% of the time, but it does pretty well. And that's because these 11 core values are built into every criteria element. And so you could map it if you wanted to, but you're going to find visionary leadership for all 12 process items. You'll even see it in the 5 results items. The same for every other core value on this screen. And I have worked in organizations, albeit years ago, that didn't necessarily share all these core values. I even know of some large ones today that don't necessarily invest that much in learning for their people. I know of others that don't consider building up their key communities that significant, even though it is. But I have found not only do the organizations benefit by pursuing this award, so do the communities. And now we have the community criteria. And to me, that's even more powerful because it's synergistic, it's holistic, it's osmotic. Community and workplace all go together. You can't separate the two. So the key question is, does the Baldrige scoring process make sense? Is a high Baldrige score an indicator of performance excellence? And personally, I don't know that I've ever seen an organization in the 700-800 range, just because there is so much depth and all that in there. Maybe it's possible someday. I'm not saying it's necessary to achieve your goals. I think if you get into that 600, 700 range, you've probably got the basic systems in place that will sustain your mission, vision, and values, but you'll have to test it out for yourself. So here's a couple of key images that describe what it's like to move towards process excellence. And Peter Block, a management consultant, years ago taught me the saying, to change a culture, you have to change the conversations. And so if you listen to how people talk, when problems emerge, when improvements are needed, it kind of helps you gauge where your culture's at. And so let's take a little look at a 4-step progression. In Baldrige, you're not going to get very many of the points, 0 to 5% of the points, if you're a very reactive organization. All we do is put out fires. And most organizations have some kind of improvement orientation. That's why they're in that 100 to 250 range on the process side. Well, no, not even that, a little bit lower than that. But their goal is get good at putting out fires. And even to this date, so many of the top organizations focus on complaint resolution versus complaint prevention. Where we want to get to is where we understand the systems that are producing the problems, change those systems, and minimize the potential for problems. That's where most organizations want to head towards. And then process excellence is where we start to get up to learning and strategically improving our processes so we don't have problems to begin with. And a very small percentage of organizations, probably 5% at best, prevention is the primary approach for protection. They cover that across the board, all facilities. They practice it at all locations. They have both primary and secondary means of protection. Some would call it overkill. But it's good for everyone to move towards 4 and 5, and you can decide how far you go. So that's one visual image. That's the percentage of points that you see there next to each phrase. This one works well too in terms of listening to conversations. So in an environment, a work culture where we react to problems, everyone goes in a different direction. We've each got our own goals. Activities, the to-do list for the day drives our efforts, and it's mainly responsive to immediate needs and problems versus long-term process needs. There aren't that many goals. Strategy and operational goals are actually pretty vague. And again, that's 0 to 25. Most organizations, there's a general degree of alignment, but there's inefficiencies in that lack of alignment. And I'm starting to get into the areas where industrial and systems engineers can help out very much, especially as we make a digital transformation. Because prior to technology, it was harder to achieve the communication speed and thoroughness and almost specialization necessary to keep everyone informed of the things they need to know without overwhelming them with things they don't necessarily need to know, more than nice to haves. It's also harder to keep track without technology, but now we're going to get to the point to where we can better align our daily jobs with the goals of the organization. Then we have everyone essentially going the same direction. Now, we still may have silos, but we're at least all going the same direction. We're sharing learnings. There's some coordination across units. We have defined strategic and operational goals. This is a case where I think there's value in moving towards the top now that we have the ability with technology to put the integration in place, to where we can use technology to make sure the interfaces and sharing occur versus a human having to make sure, well, go over and tell this person that, or make sure information from that form is incorporated into this form, or make sure this process pulls this data from this area and pulls it into this other area. So we don't have these, packages of information or tablets of information even with just pages and pages of stuff. We have tablets that appreciate the user experience and can get the user to what they need as quickly as it can and as accurately as it can, even though it holds a wealth of information. So it's in that big picture integrative role that I see industrial and system engineers playing such powerful roles in healthcare. So in summary with Baldrige, even if you don't go after the award, in every place I've helped with Baldrige, no one actually applied for the award, not even regionally. I think regional's good to get the feedback. But you can learn to assess yourself, because so much of it at the start is, wow, we don't do that at all, or we don't really measure that, or the measures that we have for those metrics don't look that good right now. And that's often because your arrows aren't pointing the right direction. Everybody's silos doing a different thing. We have to find ways to integrate folks and get value stream as primary focus, support of the value stream as secondary, but also make sure that we have time for the growth processes, the training, the process improvement, the research and development. And so the process side has 6 categories, and then we have a results category. There are 2 items each in each of the 6 process categories, and then there are 5 results categories. And you do not have to remember any of that stuff. This is just a nice little summary slide. The key thing here is that with results, we don't just look for good levels. And with the way you do things, we don't just look for, well, do you have a good planning process or not? We look at, are you involving the right stakeholders? We're not telling you how to involve stakeholders, but are you involving those that say they want to be involved from an engagement factors perspective? Do you have evidence of process refinement over time? Do you have evidence of one process feeding another, that integration feature? This is your points breakdown across the different categories. This is where you can see results is 450 out of 1,000 total points. You can see that leadership and strategy and knowledge management, measurement, analysis are relatively higher, but it's just a few smidgen points higher. This is the entire package. But like I said, I always start my assessments with results. If the organization can't show me 3 to 5 year trends, or maybe just 12 quarters in a variety of performance areas, that's going to be the first step, is starting to collect the data. And then depending on the trends we see, how much systems improvement is needed, how much systems change is needed. And so we look for improvement across a wide variety of areas, and I've got 7 of them listed here on the slide. But you can also see those 7 areas when you look at the 5 results items. The biggest one, both in terms of points and volume, we can easily have 40 to 50 charts in 7.1 healthcare and process results. And that has only, I think, been expanded with ACA. But you can see the weight the different ones carry. And you may only have 10 charts for financial and market results, but they could be 10 very significant ones in showing sustainability within your organization. Achievement of market goals for the healthcare system. Now, we will not go into actual examiner training with this. But what we end up looking at when we approach things with questions and with criteria like I'm sharing with you here is we start thinking about, well, what are those different key performance areas we need to capture measures for? What are our key processes? And believe it or not, a lot of time in any organization, the value stream processes might be defined, but those that are in support of the value stream or even further removed, they're not that well defined. Similarly, we often have measures for our service delivery processes, but they may not be all-encompassing. They may be mostly outcome measures. We may need more in-process measures. We may not have measures for some of our work systems, such as our planning system. Even our IT group, do we have the cybersecurity metrics in place that best practice organizations have? Can we demonstrate performance in terms of cost improvement? Not just revenue improvement in service lines, but can we show how we've reduced cost within given service lines, or are we left with aggregates for the healthcare system? How timely is our information? Do we get data for our process like we get data for patient satisfaction? Do we use the real-time patient satisfaction information? Do we still rely on reports that are coming in a week or two after the close of the month? But think about how effective is your tracking and performance trending. This is one of the better practice examples. This is from years ago. It's from Robert Wood Johnson University Hospital. I call it the MOM matrix because it shows how the mission, objectives, and measures link together within the organization, and then it shows how some measures are monthly, some are biannually, some are annually, but it just gives you a good start. And in this case, they did a whole lot of summary under quality where they just said core measures and then started listing different examples. But by no means is this a comprehensive list, and it is also a pre-ACA list, if you think of it from a timing perspective. Conceptually, though, it is a great way to pull your metrics together to make sure you don't have gaps. And with technology, it's a lot easier to roll up. So to me, this is the type of thing industrial and systems engineers help pull together. And then they make sure the metrics are good. They make sure the data capture systems are as lean as they can be. They make sure that we're using this information in a meaningful way to drive decision making. We're using this information to help us prioritize and make decisions effectively. We're using this information to demonstrate that our improvements were effective. That's integration with your metrics. So here's an acid test. Quick assessment. Do you know your key measures? I mean, I worked in 2 or 3 organizations before I saw the total set. Have you ever seen trend data for each of the organization's key measures? What do the trends look like? How many areas of strength do we have? How many areas of weakness? Is each area of importance measured? Do we have cases where the sample size or the N causes the measure to look very bad? Or maybe even very good? What does our filtered, our splits, or our segment data show us? And just for starters, have you reached consensus as a leadership team as to what your best-in-class comparison measures are? I worked in several organizations that have not. Important to do. And so just from a chart like this, you can get some interesting things. And what you'll notice here is we've got improvement over time in not only overall, but in each of the areas shown. And 2 of the areas are above the benchmark. 3 of the areas are above the benchmark now, and 1 is moving towards it. So these are good results. So we didn't just look at one level. We didn't just look at the healthcare system as a whole. We didn't just look at how are they doing versus a scale of 100%. We've got a relevant benchmark. We've got our splits. We've got our trends over time, and we've got our key service lines. Now, in this example, surveys provide a host of information in terms of how stakeholders feel about things, how stakeholders like to get engaged, how well different leadership approaches are working, how well different process improvement or training approaches are working. You can see in this example, we're doing pretty good, except with one group, that's the admin group. Now, how big of a group is that relative to the overall healthcare system? Is that significant? Do they consider that to be significant, given the gains in system performance, nursing, and doc growth that we see? Also notice, however, we're comparing to an average. So it always brings into question, well, where is that 25th percentile? Where is that top 10 percentile? Benchmarks matter a lot. In just a few minutes we have left, I'm going to give you an overview of the remainder of the slide deck. There are 6 different process areas, and it would take way too much time if I went through each of the 6 areas. Now, I'm following the same format of slides in each of the areas. So that's the key thing to remember. I'll go through one in a little detail, and then the others follow that same pattern, okay? Before we get going, it's very important that people appreciate process and system. In Baldrige, there's a key definition. It's called systematic. And we want things to be systematic. And systematic means well-ordered, repeatable, and we use facts and data to capture performance so learning is possible. We have many anecdotal processes in a lot of organizations. We may not have that many that are well ordered and repeatable. In other words, we do it differently a little bit each time because it's not well ordered. It's not repeatable because some know how to do it, some don't. We may have a well-ordered, repeatable process, but we never measure its effectiveness. But in the good organizations, they define most of their key processes, if not all of them. And I can share example process definitions and example matrices if you're curious. Just email me. So there's a systematic definition down at the bottom. We also look at the approach itself, which is really the workflow, like leadership development process. What does it look like? Customer engagement factor determination process. What does it look like? Strategic planning process. What does it look like? Workforce capacity and capability assessment and fulfillment. What does that look like? So there's workflows for the approaches. And deployments are more grids. That's how do we get it out to the relevant internal and external stakeholders. That's where technology, a well-designed intranet, a well-designed tablet system, that's where that kind of thing can help out there, because you're going to be deluged with information. How can we tailor what the user needs so that daily push, it's like a dynamic web page. The user only gets each day what they need to know how they did the day before, how that trends, and how the organization's doing anything important that they need to help them be effective in their job and in their life from the healthcare system's perspective. But deployment is key. Cycles of refinement is key. This is the format of the criteria. The new healthcare criteria were just released. Now there's many questions. If you count the question marks, there's lots of questions. What you want to pay attention to are the bold questions. So in this example, there's one big bold question at the top. That's the basic question. And if you get an I don't know on that, it probably means you don't have a well-ordered, repeatable process. If you can define, oh, we do a survey once a year. Oh, we use Leapfrog. Okay, cool. That's half of it. Now, how do we use that information to determine what patients need? So that's where the next two questions get a little more interesting. And notice we have one question for current customers and one question for potential. And that's so cool in today's healthcare environment, right? Because we've got our current patients, but how about patients we'd like to have? With all the payer mix stuff, with all the regulation shifts, both city and county and parish and state and federal, it makes for very interesting algorithmic potential when we start looking at how do we listen to our customers, how many different listening posts do we have, and then how do we use that information to actually make choices about what we're going to deliver. And so some real quick ways is we don't know how to do it at all, or we don't do it. Or we might do it, but it's only the senior leaders that do it, and no one else even sees the strategic plan. No one else ever even sees the financial results. We don't even have financial numbers built into our daily jobs. Not even for our department. All we know is we take care of patients. We hear about high waste when it gets too high, but we don't track it. No evidence of refinement over time. Think about it. If you use a process at least once a year, should it not be improved at least once a year? If you use it 2 to 4 times a year, should it not be improved at least once a year? Some would argue that we do plus delta every cycle. And then how do we integrate our approaches together? So think about it. How often do we survey staff? How often do we survey our suppliers? How often do we survey our patients and then not do very much with the information? How often do we deploy action plans to work groups but never follow up to see if they were actually taken care of or not? There's no closed loop. So these are some common gaps that we see, and you can have these gaps in any of those 6 areas. Now here's some example process definitions. And a very detailed industrial or systems engineer might think, well, yes, but there's multiple versions of scheduling. Yes, that's true. It might vary by patient type. But at the high level, this overwhelmed most healthcare providers. So at least here you can see we've got our value stream, major steps, the processes that are within there, And in this case, they're saying relatively the same customer requirements for each of the processes within that healthcare process area. In this day and age, it's a little more fine-tuned to the department. But you tell us what goes on this chart. We look to see if it gets you good results, if it helps you achieve your goals or not. Example value stream map, just as an example. Balanced scorecard, same type of thing. This is another key blueprint. So blueprint 1, process definitions. Blueprint 2, the balanced scorecard. We've got our process area. Again, over on the left-hand side, we've got our key performance areas across the top and then some example metrics in the boxes. This is one way of looking at deployment. How do we take metrics that are important at the site level, at the healthcare system level, deploy them down to process areas, deploy them down to individual staff? Okay, there's my little note about the 6 different examples. For each of the 6 examples, we've got some key questions from the criteria. They're not necessarily every question that's in bold. They're not necessarily the current questions. I say go through there and find the key questions in bold that you think are important for your healthcare system. You don't have to answer even every question in bold necessarily to score above 50% for an area, but you do have to show that you've got well-deployed, refined over time approaches for the areas that are most important for you as a healthcare system, no matter what your size is. This is an example of Wellstar Paulding's health system leadership system. Now, this is a conceptual model. This model is meant to show integration between the different abbreviations. You could look it all up and find out where they're coming from there, but it just shows how all the different improvement approaches tie together for leaders. But it's conceptual. This is more time-based. Now, this is not a healthcare example. It's from a transportation organization I worked at. But almost all Baldrige applicants have a leadership communication blueprint, and it shows how leaders systematically interface with staff at different levels, at different frequencies, and in different manners to achieve those goals of the organization. And one other thing you could add to this chart is the compelling why. What's the purpose of the activity? That's one thing I don't see here. But what's the medium? What's the activity? Who's responsible? Target audience, frequency, success measures. I'd say the compelling why. Why are we investing the time and effort here? But this blueprint, very common, just like the other 2 we saw earlier. Now, if you start digging into all the questions within leadership, you start getting into broader areas. Without getting overwhelmed, these are some of the more common approaches we expect to see in the leadership development side of things. And some of these actually relate to other process areas. And then finally, I wrap up the item review with some examples of how the best leaders lead. And I have many more than what we've got here. But this could help get you started. But I repeat that in the deck for planning and the other areas. Okay? So anything you're interested in, just let me know. Okay, to wrap things up, what I've found in my research, and this is my newest, freshest stuff, if we don't define leader standard work for a next-gen leadership role, it's very tough to put process excellence in place. And the reason is, without that leader standard work definition, we won't allocate adequate time for the process excellence type activities. Organizations typically try to fit it in with other things they're already doing, if we're already overwhelmed with staff issues, turnover issues, just sheer number of people to manage issues, it's going to be very hard to devote much time, and we'll burn folks out. We won't achieve work-life balance. The best organizations I've both worked in and helped very specifically budget time for these types of activities in leaders' jobs when they do their workforce capacity and capability plans. They measure against that. And Microsoft is probably one of the best examples of using Teams and My Insights to help measure leader standard work at this time. You don't have to get punitive with it. You don't have to get down to the decimal hour with it. Percentages work fine. Just the act of saying each leader's job shall include 10% time for process excellence and then making sure it happens. That's the key part, making sure it happens. That can go a long way. So I give you 10 great places to start. They're pretty basic things, but we covered these things here in this little talk. Please check out the Baldrige site. You can get a copy of the new criteria for $12 through the Baldrige site. You can buy a copy of the criteria, I believe, for $30. And just find some key questions to help you get going. I give you my connection information. I work virtually most of the time, but you never know where I might show up. LinkedIn is probably the primary place where I share what I'm doing and what I'm up to, other than my Great Systems website. But please reach out if you've got questions. I wish I could have been there to meet you at the event. I'm sorry that I'm not. But everybody enjoy the rest of the event. It'll be over by the time you hear this. But more importantly, look for ways you can learn to apply what you've learned. Too many people take a nice book of notes home, set it down, and don't do anything with it. And I know from being a part of the planning of this event that these people did an excellent job of pulling together some superior speakers to share their experiences, their knowledge, and their best practices. So take the time to look at who was on the program you didn't get to see, who would I like to connect with that I didn't get the chance to talk to at the event. Become a member of the Society for Healthcare Systems Process Improvement Group. And most importantly, keep improving. Thank you for listening, and I'm out.